next 45 minutes or so, we're going to talk about peer review. Okay, and everybody got notes? Did anybody come in late? Okay, good. Pretty much, you probably have all heard about peer review on some level, and just the words themselves give you some indication that it is a body of your peers doing some type of review. Most of the time, peer review is used to evaluate nursing services, evaluating the quality of care, and it's a continuous process that all nurses should take part in. If you get an opportunity to join a peer review committee, you should take that opportunity. It includes current processes and ongoing improvement within the hospital, such as policy and procedure development, the evaluation of care provided. It also includes staff competencies. Maybe in the hospital the past spring you heard about competencies for this week, and you need to go down and check off. And that's where every nurse within the facility has to go down and prove that they still know how to operate a chest tube or an IV pump, or one of the many things that they have on their list. It also includes continuous education, any certifications that have taken place. It includes the employee evaluations. I know in many hospitals right now they're having employee self-evaluations. That's where you rate your behaviors and performances. And I know you think this is going to go away once you get out of nursing school, that self-evaluation process. It just doesn't. You evaluate yourself, then your boss evaluates you, and then you're raised based on that. So know that that's going to stay with you. Peer review also includes monitoring unit outcomes, such as the core measures that you probably have heard about by now. And it also is responsible for evaluations such as decreasing nosocomial infections. So all of this is peer review. Okay? Now, the general purpose of peer review is to evaluate those nursing services. And typically you'll hear about peer review convening when there has been a negative behavior associated possibly with a negative outcome. It does look at the qualifications of the nurse. Is the nurse trained to provide this particular type of care? Okay. Obviously, an ICU nurse would never be pulled into such a unit as like labor and delivery. You don't have the training. Okay. So they look at those kinds of things. They look at whether or not the patient received the appropriate and the expected care. Okay. If you're expected to give medications, did you give the medications? And some of this seems very obvious behaviors, expectations. When a peer review gets a complaint, they look at the merit of the complaint. So they make sure that it's not a vindictive situation where someone who doesn't like a particular nurse is just making trouble. They weigh the merits of the care rendered. And then peer review always will make a determination or a recommendation based on their findings. So they'll bring everything in, just like in a court of law, they'll bring the information in, they'll weigh both sides, and then they'll decide what is a fair outcome to this situation. Okay? So there's a lot included in peer review. And I apologize, I'm slide on. Okay. Now, peer review, if you look in your big annotated guide, I'll give you some page numbers to refer to, but it is pretty much included on the slides up here what you'll need to look at. Okay. Each institution in Texas follows the TNA guidelines for nursing peer review, and the institutions are required to provide access to their staff to this information and this process so that you, if ever called into peer review, know what is to be expected. And there's two types of peer review. There's the full-out committee, and then there is an informal committee. And we'll talk about the informal work group committee in a few slides. The details of each are outlined in your guide on page 211, 222, 232, and 243. I don't know why they're not in a row. Okay, that would make some sense. But the purpose of peer review is to define the minimum due process. Okay. It gives the facility guidance it gives them the ability to work through the logical steps of peer review. And it's all documented, and every institution should follow these. Again, it assures that the nurses have knowledge of that plan. Okay? And then, of course, the guidance. The informal work group, which is kind of a subgroup of peer review, this is really where you want to have your resolution if possible. The board's policy is to encourage resolution and early settlement of these disputes through a voluntary settlement process. So the nurse can easily go into an informal work group, present all the information, both parties need to agree on this, okay? And it doesn't mean that the nurse in question, upon finding out what the informal group has decided, cannot then go to a full-out committee meeting, okay? So this is one avenue that you can attempt to resolve any conflict that might have occurred. It too has written policies. It also utilizes a work group nursing incidents peer review committee. The nurses' rights are maintained in the informal group just like they are for the formal group. Okay? And even if, like I said, if they don't like the outcome, you can go to a full review committee. And you as the nurse have the ability to reject their findings. Okay? The details of the informal work group can be found in your book on 227 and 228. You want to look at details. Now, the resolution of the informal work group, and this can take place in your hospital in a committee room somewhere. The decision that's reached has to go to the chief nursing officer. You do not have to have this reported to the bigger committee. The institutions who follow peer review, and we'll talk about which institutions those are in a minute, they can choose to do this informal peer review. It stays in your personal files and in their own personal files without going to a state level. Okay? But the CNO does need to know what's going on. So who has to have peer review? Any agency that hires more than 10 RNs. Okay, I'm sorry, 10 or more nurses. Okay? If you're an LVN, your peer review group will consist of more LVNs. If you're on a peer review group of RNs, then at least 5 of 10 people must be RNs. So it really is a jury of your peers. Everybody good so far? Now, committee membership requirements specifically, 3/4 of the committee must be nurses. Half of them need to be nurses at your level of practice. If LVN peer review, only LVNs and RNs can vote, meaning if you have an administrator who is not a licensed nurse, they cannot vote, although they may give information to the committee. If you're on an RN peer review, 2/3 of the members must be your RNs and only RNs vote. That's why earlier I said it's important to go ahead and get on one of these committees. These things don't happen often, but when they do, it's good to know what the whole process looks at when you're not the nurse in question. Okay? So try to get involved in these kinds of